A tummy tuck is also termed an abdominoplasty. Abdominoplasty is the medical or surgical term. Tummy tuck is an operation that is often used for women, often mothers, who have extra skin, extra fatty tissue, and often extra laxity of their muscles after pregnancy and childbearing. It's not uncommon for women after they've had even one child to have skin and muscles that are now lax, and that despite their best efforts at diet and exercise, these areas just simply do not improve. It's often hard for other people who haven't born a child and haven't had these kind of changes in their body to fully understand the implications of these changes. For many women, it's not about necessarily showing this area of their body off. It's more about feeling comfortable in their own skin with changes that have occurred naturally just due to motherhood. And often people think that if I just diet or if I just exercise a little bit more, I can flatten that lower tummy area out. But as many women come to find that despite all their best efforts at diet and exercise and right lifestyle, these areas often just simply do not change. They're refractory to their best efforts. And so these are the patients that are great candidates for an abdominoplasty or tummy tuck procedure, which essentially tightens the skin of the lower abdomen, particularly the area below the belly button. It's accomplished through using an incision or a scar that sits in the bikini line, kind of across the lower abdomen. And through this incision, we're allowed to both remove extra skin and fatty tissue, as well as tighten the abdominal musculature, essentially restoring the muscles back to where they were before babies. And then in essence, flattening the abdomen, recontouring the abdomen, and often this procedure is combined with a small amount of liposuction in an effort to contour the sides or the flanks of the abdomen at the same time. A tummy tuck can do different things for different patients. Depending on the extent of the extra skin and fatty tissue, a tummy tuck can simply just be used to remove extra skin and fat that's redundant in the lower abdominal region. It's important to realize that skin and fat does not, especially extra skin, does not respond to diet and exercise. It's kind of like a pillowcase that once it's been stretched out, often will never resume its previous shape and often needs a tightening procedure or a tuck procedure to tighten that area. For other women who have muscular laxity of their abdominal wall, these are women who will notice that they have a permanent pooch kind of in the lower abdomen despite having lost fatty tissue that they acquired during pregnancy. And for these women, it can be particularly frustrating because finding clothing that fits, often these women are plagued by going to the closet to pick out clothing. These are the women who will often say, if I find something that fits in my abdomen, it doesn't fit in my hips. And if it fits in my hips, it doesn't fit in my lower abdomen. And so they're constantly frustrated just by the process of finding clothing that fits properly. And so for these women, restoring a flattened pre-pregnancy contour to the lower abdomen is a great benefit. It is important to understand that the cost of the procedure, and I'm not talking financial cost, the cost of the procedure is a scar across the lower abdomen. So these are women who need to understand and kind of buy into the notion that there will be a scar exchanged for this tightened, flattened, more contoured abdominal region. The best candidates for a tummy tuck are women who have a significant amount of extra skin and fatty tissue in the lower abdomen, meaning an area that you can grab or pinch between your hands or between your fingers, and also women who have muscular laxity of the abdominal wall. Often these are people, again, who have had children, who have gone through pregnancy, although there are patients who can have laxity or excess skin and fatty tissue in these areas that's just associated with significant weight loss and has nothing to do with pregnancy at all. These women often don't have the underlying muscle problems, meaning that the muscular laxity is not their main issue. It's simply the extra skin that's left behind after losing weight. For women who don't want a full tummy tuck, there is a procedure that's referred to as a mini abdominoplasty, meaning a smaller abdominoplasty. Essentially, this is a procedure that is intended only to tighten skin and to a lesser extent tighten muscles. But unlike the full abdominoplasty or full tummy tuck procedure, which tightens the muscles all the way from the pubic region throughout the entire abdominal wall up to right between the rib cage, the mini tummy tuck or the smaller tummy tuck only tightens the musculature that's below the belly button. So these are for a more specialized subset of women that only have a small amount of excess skin that bothers them in the lower abdominal area and have less underlying abdominal bulge or abdominal weakness.